Improving evidence for health policy making is a core part of WHO's vision. I am delighted that we have established a regional network of institutions for evidence and data to policy, and look forward to working with our member states and partners to develop strong evidence-based policies across our region.
During the COVID pandemic, countries across the world have had to make critical decisions without adequate evidence. Having a network like the Net2P is therefore an essential long-term investment to help secure health in the Eastern Mediterranean region.
The aim of the Net2P is to act as an engine for evidence-informed policymaking and to strengthen the institutionalization of these processes at national level.
In countries where mechanisms and institutions for evidence to policy exist, it's easier to use these mechanisms and institutions to make sure that science reaches policymaking level.
The East Mediterranean region is not short of experience or expertise in evidence generation, adaptation, and implementation. This network is an innovative initiative and a milestone in the history of evidence-based healthcare in the region.
The Net2P works to strengthen capacities to improve availability, quality, and use of evidence for decision-making. It allows countries to share experiences to facilitate country-to-country learning, and it also provides technical support, tools for communication and advocacy, and guidelines for important health policy-making activities.
This regional network will enable us to support Ministry of Health by providing the tools required to support decision making. This network also provides guidance to countries for developing national mechanisms to support and enhance evidence-informed policy making.
One of the most important areas where we can expect support is the enhancement of demand and advocacy through training of senior policymakers. We also expect the network to provide training to enhance the technical capacity of the Ministry of Health and the Institute staff in a critical appraisal of knowledge, products, and evidence synthesis reports.
The Net2P network can also develop simple tools and frameworks for establishment of a national HTA system and for conducting local HTAs, and also for transferring and adopting HTAs from other countries and from other settings according to the context of EMRO countries.
The regional network of institutions can greatly support equity-oriented decision-making.
Organizations, initiatives, and networks that support evidence-informed policymaking can play critical roles in bridging the divide between science, policy, and politics. We at the Knowledge to Policy Center of the American University of Beirut are excited to be part of this network and to join efforts in a region where strengthening evidence-informed policymaking and contributing to achieving sustainable development goals for health is much needed.
I think EVIPNet can be critically important in the work of the network. It complements the work of the data folks, the guideline groups, the HTA groups, and it brings to the table a set of approaches that I think really are very, very helpful in spurring evidence-informed policymaking.
The Net2P offers a platform for countries to improve national and regional capacity for knowledge products and evidence-informed policymaking processes. And it will help bridging the gap between policymakers and researchers.